tools like we provide to our clients really help kind of prioritize where to focus the effort, where you can have the greatest impact on lives and on outcomes. And I know, care is always the number one priority, but, these organizations have to keep the doors open somehow. So being able to certainly be as efficient and maximize the dollars possible for these folks to deliver the best care.
Welcome to Business Ninjas, brought to you by WriteForMe, where you'll hear from business leaders who are out there growing their business and slaying it every day. Learn from the masters. Let's get started.
Hi, and welcome to another episode of Business Ninjas. I'm here today with Todd Schlesinger, Vice President of Sales and Marketing at Azara Healthcare. Todd, how are you today?
Good morning, Andrew. Wonderful. Happy Monday. Thanks for having me.
Oh, my pleasure. I appreciate you spending some time with us on Business Ninjas. Please tell us a bit about yourself and a bit about Azara Healthcare.
Sure. Well, again, thanks for the introduction. Todd Schlesinger, responsible for sales and business development here at Azara Healthcare. Azara has been a leader in population health and value-based care solutions for about 14 years at this point, provide a series of tools to help support our clients in their value-based care journeys, work with them to support their quality initiatives, and ultimately improve efficiency of care.
Excellent. And what's your background? How did you end up at Azara?
A long journey, but in healthcare IT for over 22 years, I guess, at this point. I have a technical background in information and communication sciences, and kind of accidentally fell into this healthcare IT thing. I always joke with folks, after graduate school, I just wanted a job, and ended up with a really neat company, First Consulting Group, who were one of the premier healthcare IT firms in the country at the time, and had an amazing group of leaders in that organization that said, hey, we'll teach you this healthcare thing if you could bring some of your technical experience as we collaborate with clients. And I kind of fell in love with it. And next thing you know, I've, like I said, over 20 years and still been in healthcare IT.
Excellent. I don't want to make assumptions. What verticals are you serving with your platform? Who are your clients at Azara Healthcare?
Sure. We started 14 or so years ago, focusing really on the safety net, the federally qualified health system market, but really a robust set of population health tools really serve a broad range of healthcare clients, including the commercial provider organizations, as well as health plans, ACOs, CINs. We really have a pretty mature set of tools that have really helped kind of support the full healthcare ecosystem.
Excellent. And what are the most common problems you're solving for your clients?
Some of the core issues that we focus on is the ability to aggregate huge amounts of disparate data from multiple systems, multiple locations, ultimately to be able to provide data analytics, data analysis, provide meaningful and actionable insights to folks. Quality measurement and reporting is really at the core of everything of that data analysis, is to be able to look at how are you performing, how are we improving, ultimately improving care, and providing insights and care coordination and care management, as well as, as I mentioned, your value-based care initiatives to help kind of navigate the complexities of all these different payment models that our clients are working in today. So it really is all about kind of pulling data together and providing meaningful information on how they can action on it and improve care.
As a layman, I'm frankly amazed that the health and care industry manages to sustain itself. As a patient, I see how long it takes before I get something that says this is not a bill. And then I'm notified maybe 120 days after I see a doctor that my insurance company has paid, 12 cents on the dollar or something. I don't know how the entire industry makes a go of it, but obviously you're helping people make actionable decisions in terms of sustaining themselves.
For sure. For sure. I think, identifying kind of which patients are at greatest risk of an adverse outcome and helping the care teams take the appropriate action, know where to prioritize. We know in the industry today, we're often hearing about how these organizations are really hurting for resources. And so how do you maximize the efficiency and the effectiveness of the resources that you have? Tools like we provide to our clients really help kind of prioritize where to focus the effort, where you can have the greatest impact on lives and on outcomes. And I know, talking about the dollars is always, your care is always the number one priority, but, these organizations have to keep the doors open somehow. So being able to certainly be as efficient and maximize the dollars possible for these folks to deliver the best care.
Absolutely. What what's the biggest differentiator in the market for Azara Healthcare? What makes you stand out from your competitors?
I think I touched on it. The kind of our core is being able to really aggregate data across systems and ultimately deliver meaningful information. So clinical data from your EHRs and in some of the, especially in the safety net space where we're working with primary care associations or the HCCNs that have numerous health centers associated with them, all have different EHRs. So to be able to aggregate that data to have a meaningful view of the patients that they serve, but then tying into that health plan data. So it's claims, it's rosters, it's care gap data, as well as like HIE data, really, really gives a holistic view of a patient and their risk. So I think aggregating all of that information and then pushing out meaningful visualizations and meaningful insights to folks to be able to take action on it is really where our bread and butter lies. And, the end of the day, it's being able to look at that and say, all right, how am I performing? How is my quality? Being able to look at specific measures to see how you're performing and where you can focus resources and where you could focus effort within your organization to care for your patient population.
Absolutely. Switch gears a little bit. Tell me about, I assume it was challenging sustaining and growing a business in the healthcare sector through and after COVID. Tell me about the challenges and opportunities that were in front of you.
For sure. I think one, we're all know how difficult it was during that time, but not being able to be in front of your doctor, actually to go for follow-up appointments and certain procedures was hard, certainly for everybody. Hats off to those technology providers that were able to quickly pivot and provide things like telemedicine, telehealth tools that allowed folks to still at least receive diagnosis and receive care where possible. But certainly the resource constraint was very difficult for folks. So again, using a tools or set of tools like ours to make the existing resources as efficient and effective as possible was critical to be able to still manage the patient lives that you're responsible for. Something we felt we really were able to help support.
This is how you look at things. Every challenge is an opportunity. And unfortunately, people had to suffer in order for some companies to find a new footing and new technology and new approaches. And you got to make the best of what's in front of you. What role has content played in the growth of Azara Healthcare? How are you telling your story? How are you getting the word out?
Well, I think having these types of conversations has certainly been great for us as we've continued to deliver for our customers and we continue to build I've been with Azara only for just about little over 3 years, and our reputation has long preceded me. And hearing from our clients the fact that we're even back-to-back best-in-class research winners for what we deliver to our clients, that we continue to deliver what we promise, and if not exceed expectations in the markets that we serve. has really been amazing to see. We have so many examples of success stories, case studies that we've built out, clients who are excited to share their stories. Really is kind of a wonderful position to be in. Someone in my role in sales and business development and marketing to be able to leverage all of those. But we have such an amazing team of folks that collaborate very closely with our clients. Many of our clients have actually been with us for we have clients that are over 10, 12 years that have worked with us, which is pretty impressive for a technology solution provider. I truly believe that. And so to see the trends and how they've leveraged our tools to help support their quality and reporting needs and help improve performance and outcomes with their patients, I think speaks for itself. But, we rely heavily on our clients to speak to the value that they've seen from Azara, and they do an amazing job telling our story.
Hey, you provide an important role in helping free people up to provide medical care. Most doctors don't want to be businessmen and look at numbers on a spreadsheet. They want to care for patients, and it sounds like Azara is helping people, free them up to do what they're tasked with doing.
For sure. It really, like I said, one of the most amazing things is how long some of our customers have really been with us. And so the application of our tools within those organizations continue to evolve and grow, and we do more things with them. There's lots of modules and other analytics tools that can be built on top of our core platform that our clients leverage constantly. And so that growth and expansion and the application across their patient population is really pretty neat to watch.
Excellent. Look down the road a year from now. What are some things you'd like to be celebrating personally and professionally?
I think professionally, to see the organization cross the 15-year mark in this industry, and we're approaching a huge customer base across 44 states. Not sure that we'll get to 50 necessarily, but that's pretty amazing and something I'm pretty proud to be part of. And I think continue to support the evolving value-based care initiatives, how to help support and improve costs for these organizations, where to prioritize those resources and ultimately improve outcomes. Something I'm proud to be part of. For me personally, I think, all of those things tied up to say that I'm part of an organization that really does improve care, improve outcomes. There's lots of technology out there. There's lots of amazing tools out there. And I'm pretty proud of my career and the organizations I've had the opportunity to represent. But to see this in action, to see Azara Healthcare continue to deliver on what they promise, that to me is something I don't take lightly. I think it's really pretty special. And so, as I look to a year, 2 years, 3 years, 5 years, to continue to support my team, the sales and account management and marketing organizations, and ultimately our clients, we continue to deliver on what we say and what we promise. That's something I certainly look forward to.
Please tell us, what's your URL? Where can people find Azara Healthcare, and what social media outlets are using these days as well?
Absolutely. Would love it. People come visit us at azarahealthcare.com, and certainly LinkedIn. They could find us hashtag Azara Drives, as well as X. And we would love for people to check out our content. And we're always putting out new white papers that are available for folks to see and read about some of the success stories that I referenced before. So yeah, come check us out.
Excellent. Todd Schlesinger at Azara Healthcare, thank you for spending some time with us today on Business Ninjas. All the best to you and yours, and continued success at Azara Healthcare.
Thanks, Andrew. I appreciate it a lot.
Be well.
You too.